Welcome everyone to this healthcare ethics and law talk. Today we're going to be looking specifically at dental ethics. So we're going to be looking at some core ethical principles and frameworks within dental ethics, and also understand how these ethical theories relate to dental practice. And then we're going to also help you to confidently discuss dental ethics in the context of some case studies. And we're going to also look at themes, for example, the changing dentist-patient relationship, and also professionalism and how this relates to ethics as well. So firstly, you just want to reflect on what ethics means to you. It may be something that you see in your practicing life as a healthcare professional, as a dentist. It could be something that you think about on a day-to-day personal level. So it can have a lot of different connotations. So we're just going to think about, firstly, what ethics means, and we're going to just situate ourselves and look at where exactly we are and exactly what we're talking about. So as you can see from this Venn diagram, usually in healthcare, ethics and law have a huge amount of crossover. Again, we may look at things like consent, and that obviously relates to legal cases such as Montgomery or Bolan. But today we're just going to be looking at specifically the ethics part of this and see how this relates to dentistry in particular. So normally we consider morality or ethical decisions to have a right or wrong, and that they're black and white, that there is a clear distinction between morally right and morally wrong, and when we have a dilemma there's a clear answer. In reality, this isn't the case. Ethics and morality, it's not that clear, it's not often that objective, it's usually subjective. It can be depending on your point of view. So really what we're looking at is a grey area which exists between two extremes. And that's really what we want to look at today, and that's why a lot of the ethical dilemmas that we'll look at, there's no clear answer. But what we're trying to do is look at ethical theories to give us a guide on how we might go about thinking about what's morally right and wrong in different situations. So that's really what we're trying to achieve today. So firstly, I just want to look at what ethics is in general. Now, ethics is a branch of philosophy, and the field of ethics, as we can see here, involves systematizing, defending, or recommending concepts of right and wrong behavior. So what does that mean? Well, essentially, an ethical or moral theory has to look at what is the right or wrong action in moral terms, and it has to give us some justification as to why this is the case, and give us a way of distinguishing this for ourselves. We're going to be focusing on three main ethical theories. Firstly, consequentialist ethics. Secondly, we're going to look at non-consequentialist ethics, also known as duty-based ethics or deontology. And finally, we're going to look at virtue ethics and look at things such as professionalism. So first, let's look at consequentialist ethics. Consequentialist ethics says that what is morally right or wrong depends on the consequences that the action brings about. So that means that a consequentialist moral theory has to justify what quality or what it is about the consequence of an action which makes it right or wrong. And so we're going to start by looking at utilitarianism, which was proposed by Bentham and also Mill in the 19th century, but which has been around for a long time. Even philosophers such as Epicurus in ancient Rome were looking at this. And what it says is that what we desire is happiness and the absence of pain, and that the morally right action is the one that generates the most happiness, or conversely the least amount of pain. So essentially, this form of consequentialist ethics is saying that the right action is the one where the consequences of the action bring about the most happiness. So let's look at that in a very simple, reductive example, just to help illustrate that. We can see here, let's imagine we've got an ethical dilemma, and we're trying to figure out what the morally right action is here. And so we've got three actions: action 1, action 2, and action 3. And so let's focus on action 1 to start off with. It produces 20 units of happiness and 10 units of pain, so overall it produces 10 units of happiness. Action 2 produces 15 units of happiness and 0 units of pain, so overall it produces 15 units of happiness. And we look finally at action 3, which produces 10 units of happiness but 5 units of pain, so overall it produces 5 units of happiness. So utilitarianism would say that in this situation, the morally right action is action 2 because it produces on balance the greatest amount of happiness. And so we can see that the advantage of this in medical or dental ethics is that it's quite simple to use and we can compare a variety of different options, and it gives us an objective approach. So it tells us this is the right answer based on what we're looking at. However, there are drawbacks to this, and I'm just going to focus on one famous thought experiment from the philosopher John Harris, and it's the survival lottery thought experiment. And what this asks us to do is imagine we have 5 patients who require organ transplants. And on the next ward is patient A, who has a curable disease, let's say he's got the flu, and is a suitable donor for the other patients. So we can see this here, we've got 5 people versus 1 person on another ward. And utilitarianism and John Harris, they look at this and say, okay, what's the morally right action here? Well, technically we could sacrifice this one individual's life, take their organs and save the other 5 people. And if we say that each person's life is worth 100 units of happiness, then it justifies, on balance, taking the healthy person's life and sacrificing them in order to save the 5 people. Because on balance, that produces the greatest amount of happiness. However, we can see this is clearly the wrong result. It's abhorrent and we would never do it. But what does it show? Well, it shows that just by producing the most amount of happiness, it doesn't necessarily mean we will reach the morally right answer. And so that's one famous disadvantage or drawback of consequentialists, the utilitarianism theory. Another objection is by philosopher Robert Nozick, who says that we don't just desire happiness, we desire other things too, for example, fulfillment and authenticity. Another objection is that we end up performing what's called a utilitarian calculus. So essentially we're just reducing this decision down to a sum and looking at how we produce the most happiness, and we're going simply on that basis. But we can't always predict the consequences of our actions and how things are going to turn out. So that makes it quite difficult. So in summary, consequentialist ethics claims that whether an action is right or wrong depends on the consequences that the action brings about. And utilitarianism, the most famous example of this, claims that the right action is the one that brings about the most amount of happiness. Then I want to move on to looking at the next ethical theory, non-consequentialist ethics, also known as duty-based ethics or deontology. And in contrast to consequentialist ethics, this says that some actions, regardless of the consequences or amount of happiness that they bring about, are morally right or wrong. For example, if we look at the survival lottery thought experiment, even though sacrificing that one individual produces the greatest amount of happiness, it's clearly the morally wrong result to sacrifice and kill that individual for the sake of the others. So duty-based ethics says that there are certain duties or rules which we are morally obligated to adhere to and respect, and what is right or wrong is based on this set of rules or duties which we can derive. And this is regardless of the consequences that these actions bring about. Simple examples of these are don't kill, don't cheat, don't steal. In dentistry, we can see these in the form of professional standards, the most famous being the GDC standards for the dental team. We can see an example of these in practice here. We've got an example that's taken from the GDC website to illustrate how the standards are used and implemented in ethical and medico-legal scenarios. So we can see here the GDC received a complaint from the mother of a teenage patient. She complained that during her son's appointment, the dentist said several things which she and her son found offensive, including that men were superior to women, his views about the prevalence of homosexuality in particular cities, his views about dentists' wages in the UK, and that the British government had begged him to work in the UK. The patient's mother also alleged that the dentist had said, "Thank you for the filling," in a sarcastic tone when they left the appointment. So the GDC said that this behaviour breaches the following standards. So firstly, standard 1.2, you must treat every patient with dignity and respect at all times. Standard 1.2.1, you should be aware of how your tone of voice and body language might be perceived. Standard 1.3.2, you must make sure you do not bring the profession into disrepute. And finally, you must not express your personal beliefs, including political, religious, and moral beliefs, to a way in patients that may exploit their vulnerability or could cause them distress. So we can see from this example the very specific rules and standards or duties that the dentist in that scenario has breached. And so we can see that non-consequentialist ethics provides a clear list of these expectations and duties which we have to adhere to. They can also be added to and adapted as societal expectations change, and that's one real benefit of this situation. And finally, the principles are action guiding and simple to use in ethical situations. In other words, they really help you and tell you quite clearly what is right or wrong in a given ethical or moral scenario. And so it's obviously a very good ethical theory. However, there are some issues. Firstly, what do we do when duties conflict? Well, it doesn't really give us a clear indication in this case. For example, let's look at water fluoridation. Here we can see a conflict between autonomy. On the one hand, we've got forced medication against public consent, and on the other hand, there's a conflict and tension created between beneficence or doing good. And the evidence shows that water fluoridation can provide a benefit to the oral health of the population. And so have a think about what your views are on this. How would you resolve this conflict? And do you think that utilitarianism would offer a better solution? So that's just something to think about for yourselves. And as I've mentioned, this can create quite a rigid view of ethical dilemmas and leave you in a difficult position if you can't resolve these tensions. Now we're going to look at the final ethical theory today in this lecture, which is virtue ethics. And a virtue is described as an excellent trait of character, for example, being trustworthy, noble, or brave. And philosophers such as Aristotle, they don't focus on the actions or the results of actions. For example, in consequentialist and non-consequentialist ethics, what they say is that we should look at the character of the individual, and that an individual who has a virtuous character is a moral individual. And the concept of virtue, as Aristotle says, just by possessing it makes the individual good. And so how do we know which virtues are morally good? Well, Aristotle says that we get this through experience, and that once we adopt these moral characters, throughout time and with the experience, we habituate to adopting the right virtues and therefore the morally right actions. And we can see an example here of what is the right character or characteristic to have. We can see that in between two extremes, we've got on one hand cowardice and one hand recklessness. We reach this what's called a golden mean of courage. And so this is how generally we know which virtues are good. They're between two extremes and they exist in this golden mean. And it's really related to professionalism. Virtue ethics, we can see it all over definitions of professionalism. For example, the Royal College of Physicians definition, which is a set of values, behaviours and relationships that underpin the trust that public has in doctors. And it suggests virtues and values such as integrity, compassion and altruism. But over time we can see that the virtues and expectations of us as dentists has changed. We've moved from this paternalistic relationship in which we would, in the past, a dentist would tell the patient what treatment they have and then have little interaction within that, to a more consumerist and autonomy-based relationship in which themes such as consent and informed consent predominate. So within dentistry, the University of Cardiff and the GDC did some research into professionalism to look at how it's changed and to give a contemporary view of it. And they had some key findings. Firstly, they found that good communication was paramount and key, and that's from communication in regards to respecting the patient and their dignity, to having a discussion and a dialogue in regards to themes such as consent. And all members of the team are expected to act with professionalism. That's from receptionists to the dentists themselves. And there was a difference in the expectations from society on the actual dentists themselves, on their social lives and how they appear, for example. And that's changed over the years in something which is clearly socially relative and something that will change again, I'm sure, in the next 20, 30 years. It also said that there's a lot of new advances and challenges in professionalism, for example, social media, which they saw was a risky space, both in regards to colleagues and patients as well. And some key values that they found and recommended that's from research and discussions with patients is looking at communication, empathy, compassion, politeness, friendliness, and also building trust and rapport between the patient and the dentist, which is something that is a value which appears to be unchanging. And so, in summary, virtue ethics, it focuses on the individual and their character and their disposition as opposed to their actions. And these values and virtues can be modified and relate to professionalism. We can see how they've changed through the years. The disadvantage is it's not necessarily action guiding, so it doesn't tell you exactly what action you should do in a certain moral scenario, and that can be quite difficult. It says be courageous, but how does that really relate to the situation you're in? And there's also could be some debate about what values and virtues are morally acceptable. Obviously, it depends on society and it's socially relative, so it could vary from country to country, for example. So in conclusion, ethics, it relates to dentistry in a number of different ways, as we've seen throughout this. For example, utilitarianism, it can relate to things such as public health, quality of life to adjusted years. Duty-based ethics, we can see it in professional standards and virtue ethics. We can see relating specifically to professionalism. And so, whilst ethics and philosophy appears quite abstract and difficult to get your head around, it does really relate to what we do and underpins a lot of ethics within dentistry and healthcare. So if you want to find out a bit more about this and also other topics within healthcare ethics and law, visit our website, which you can see in the link now, at www.healthcareethicsandlaw.co.uk. And you can also find our podcasts on Spotify and other podcast providers, and you can follow us on social media via the links in our website. So thank you for listening. I hope it was helpful, and hopefully you've learned and gained some insight into dental ethics. And as I say, if you'd like some more information, more links and resources, have a look at our website, and there's loads more stuff there. And we look forward to seeing you in the next webinar. Take care. All the best.